Afternoon and welcome to number 6 Convent Place once again. We've been on lockdown now for just under 4 weeks on Tuesday. Those of you over 70 for longer than that. This is not what we're used to, and we don't want to get used to it, especially on a fine day like today, but it is where we are, where we have to be. These are still not ordinary times. Let's think back just a few weeks ago to when people were wanting action and wanting lockdown, as we saw what was happening in other countries and as nearby as in Spain. So it is disappointing to see that some people are not keeping within the law. Our lockdown has been sympathetic, trying to be flexible and understanding, much more so than in many other countries. But sadly, there are those who are not respecting it, even now, and are using the reason of exercise to go out, not to exercise, but to socialize. This is not allowed, and it's not acceptable. This is against the law, and most importantly, is playing right into the hands of the coronavirus. Remember, a walk is not a picnic. Please stay at home. Of course, it's not easy, and of course, it can be stressful. So it's important to focus on the positive, to make the best use of what for some may actually be more spare time, perhaps to revisit some old hobby or start a new one, or catch up on some book you've always wanted to read or reread, or a TV series you remember from years ago. I'm sure we're all looking for things to occupy the time and, importantly, the mind. My colleagues in culture are working hard to keep us all entertained. Gibraltar Cultural Services continues to work with GAMPA on the cultural online program, which is aired weekly on both their websites and Facebook platforms. Tomorrow, they enter week 5 of the program that will once again include many cultural activities, programs and recordings. This week, we'll have 2 special features. Jetstream, live from St. Michael's Cave at the time, and Paul Coschieri's University Mural. I take this opportunity to thank all my cultural team, GAMPA, the Bulb, Gib Media, and the many cultural entities and individuals who have come on board to support the online program, which is proving very popular. GCS is also already uploading the many cultural archives that have been forwarded to create the new Cultural Archives TV. You may recall we recently launched a new project jointly between GCS and GBC. This new initiative will allow our cultural heritage to be accessible to the community, not just during these times, but in the future as well. We've already received footage from various entities, including Mount Productions, Transitions Dance Academy, the Gibraltar National Dance Organization, and MO Productions. I call on the many other cultural organizations and individuals who may have them to send their material. Some of you will know that I have a past in the performing arts, so I forwarded some of my own material too. I'm not sure I'm looking forward to you all seeing that, but there we are. I think it's a great initiative. We've also launched a fortnightly drawing, painting and short story competition aimed at children and young people from school years 3 to 13. And during lockdown, many people seem to have been spending their time creatively on Lego. We are planning an exhibition of Lego to take place after lockdown, so please contact GCS if you're interested in showing off your work or that of your children. Elsewhere in my ministry, I can report that we have now received an updated analysis of air quality since lockdown. A press note with the details will issue sometime this coming week. Results show that levels of the pollutant studies have decreased throughout Gibraltar. Those for which we have data so far are nitrogen dioxide, the combined oxides of nitrogen known as NOx, and particulate matter, both TM10 and the smaller and more dangerous PM2.5. This improvement in air quality is most likely the result of reduction in traffic and also construction and ship repair, particularly in the South District. There will have been reductions, of course, from neighbouring areas across the bay, which could also be contributing to these results. The results are to be expected. They prove that traffic is probably our main source of diminished air quality, which should encourage us to redouble efforts to deal with this after the current crisis, when we start to regain a reviewed normality. The fact that poor air quality affects respiratory health is particularly significant, as this would be key to good health in later years if COVID-19 becomes endemic. For the moment, I guess one consolation of the difficulties we're living through is the fact that we are breathing cleaner air. I'd now like to say something about the more vulnerable in our society. From the onset, the contingency planning under the leadership of my friend and colleague Samantha Sacramento, Minister for Civil Contingencies, has included vulnerable groups within the community in order to assess needs and mitigate their risks. These include, of course, all ERS residents, citizens over 70 with little or no support network in the community, vulnerable children in the community and in care, adults with disabilities in the community and in care, and others deemed vulnerable by individual assessment. A multi-agency approach has been adopted, coordinated by a civil contingency lead dedicated to vulnerable groups. Key departments under this remit include housing, ERS and the care agency. And as a result, a number of services have been initiated, including the Meals on Wheels for those primarily unable to cook, provision of food supplies through dedicated response teams, and a temporary homeless shelter at the Garrison Gym with a building facilitated by Europa Football Club. In excess of 3,600 telephone calls have been made to vulnerable over 70s and others so far with GIB Telecom support. Dr. Hiraldi Home and St. Bernadette's Occupational Centre have also been increased in capacity in order to absorb an increase in demand. And we must be really grateful to all those involved in all of this. And I'd like to take the opportunity to send our best wishes, I'm sure the whole community will join me in this, to someone who has done so much for vulnerable people for many years. Emily Olivero of Clubhouse Gibraltar, happy birthday. I must also thank the supermarkets and wholesalers for their efforts in keeping social distancing, the hard work restocking shelves through the night, donating food banks, and doing the over 70s deliveries. And talking of deliveries, thank you also to all the delivery drivers who are providing such a service around the rock. Hungry Monkey, Rock Heroes, Vepo and Nom Nom, sustaining us through all these weeks. Before I go on to the daily stats, I just want to make some general comments on the figures. A great deal of work is being done on this novel coronavirus and the disease that it causes, COVID-19, around the world. We have teams continuously monitoring this research. Over the past few days, two reports in particular have come to my notice. One is the EU roadmap towards lifting containment measures, and another is an analysis and model for COVID-19 within the UK Overseas Territories, the OTs, prepared by Public Health England. The one on the OTs is relevant because of similarities in size and age composition. Interestingly, the projections for Gibraltar produced by Public Health England, assuming we had taken no containment measures, was an expectation of at least 300 deaths. Of course, with models, you can never tell exactly what would have happened, but fortunately, our measures so far have prevented this. But as I always say, we must not be complacent. The EU document concentrates on the process to reduce containment, or unlock, as we call it, and considers what has to be borne in mind before unlocking and how these steps should be taken. Spain yesterday announced some tentative plans for unlock, largely following the EU guidance. Our own situation will be informed by what's happening elsewhere, but clearly, as we have done so far, will take into account our particular circumstances. You will not be surprised to learn that one of the primary concerns of the government at this stage is, of course, looking towards our own unlocking. As you know, Cabinet is meeting at least weekly by virtual link, and this will feature greatly in our discussions this week, starting tomorrow morning. Many of you will have thought about the next steps, perhaps increasingly so as the days go by, and will have had different opinions that you've discussed in your own homes. Rest assured that we're looking at all the considerations and options based on public health advice, both our own and that of the World Health Organization, while keeping a close watch on developments elsewhere. This isn't easy. It's a huge responsibility, like it was to deprive our people of basic freedoms. I don't know, but somehow this next stage feels more complex. And that is because we have got to get it right. If we are to prevent this deadly virus, I repeat, this deadly virus, from getting a hold on us. Remember the news we hear around the world. 800 dying still daily in the UK alone. We are just as susceptible to the virus in Gibraltar. We are not being spared by magic, nor because we are special. We must keep it at bay. Last week I had the opportunity, together with my colleague Paul Valbin and the Director of Public Health, Sohail Bhatti, to have a private video conference with Professor David Heyman, a top advisor to the World Health Organization. We were able to get a first-hand update on the latest WHO thinking, as well as to discuss our past actions and possible next steps. It was very reassuring to find that our position could not be faltered, and how our early action in particular in protecting the elderly has been so effective in saving lives. So far as we can all tell, we have been keeping this virus largely at bay. But if we were suddenly to reverse all the lockdown steps without precautions, we would be inviting it in. Then the horrendous scenarios we have seen in other countries would also be invited in. And although our tactics have meant that we have had the time to prepare, we simply do not want to see that. And so, despite our frustrations and our anxieties, we have to do this carefully and responsibly. Trust us, as you have up to now, to do the best possible to ensure that, yes, we start on the road to normality, but our community is still protected. In the meantime, the advice remains. The virus is lurking. Give it a chance and it will strike, and strike hard and with a vengeance. So stay at home, keep your distance, wash your hands. And now for the numerical information. In the last 24 hours to 8:30 this morning, by statistics presented to us every morning promptly by Krish Rawal, who is here with me today, there were 30 attendances, of which only 3 were with COVID symptoms. All were swabbed. Of these 3, 1 was admitted to COVID CCU late yesterday. The patient is stable, not ventilated, and I believe the result was negative. Thank you, Krish, for that very latest update. As regards the tests, the grand totals, taking in the normal and the random 400, total swabs 1,912, pending 36, results received 1,876, negative 1,695, confirmed 132, active 12, recovered 120. As you can see, the recovered cases are almost the same as the total confirmed, with only 12 active. This is great to see, but please don't get complacent. We've all seen most people doing what they should, but also others who are not respecting physical social distance. This is the opportunity the virus is waiting for. Please, please keep to the rules, because they are what the law requires, but because you know they make sense. People will die if we get a resurgence in cases. And it is you out there, not us, who are the ones who can stop it. We may have been able, all of us, to turn the wave into a ripple. But remember, the sea goes calm and moves out just before the tsunami strikes. Krish Rawal, Medical Director of the Gibraltar Health Authority, all of whom are doing wonderful work for our community, will now address you. Krish.
John, thank you very much. Good afternoon, everybody. I hope everybody's well and everybody's safe. and I hope everybody's safe at home. I know you haven't seen me on your screens for the last 10 days or so, and thank you very much to those of you who've sent me messages actually asking after my well-being. I can absolutely assure you I'm extremely well, as is my amazing wife and amazing children, as are my colleagues, all of whom are well. And in fact, the reason why we've had a little bit of a change with the press conference is that now that we're increasing our teams, we have some very interesting people, some experts in their fields who are joining our teams and advising us. So you will see some change in the faces simply to just give you a little bit more information, a little bit of a broader view of the virus and what we are facing. However, of course, I am very glad to be here, and I've got plenty of things to tell you about. Minister Cortez has covered the statistics. Moving on really to the bed statistics. I know these figures that we give you as regularly as we can. Just to let you know, we have now, across all of the sites that the GHA covers, 756 beds, which is a pretty amazing figure, I would say, of which 333 occupied, 423 are free beds at the moment. And that's broken down to 205 beds at St Bernard's, 238 beds at the Nightingale facility, and 313 beds in total at the elderly residential services. So all of those areas we have moved beds around, we've consolidated, and we've increased our capacity very, very significantly. Moving on from there to some more statistics and progress updates from the GHA. In fact, the last time I was on a press conference, I was asked a question about the CCU1, our COVID intensive care, which I was unable to answer at the time because I didn't have the figures to hand. So just to let you know that our CCU1, COVID CCU, was actually opened on the 23rd of March due to reconfiguration of the wards and moving of some of the facilities to different clean and dirty. You hear these terms, but essentially the wards that have the patients with the virus versus those that do not. So 23rd of March, and since in fact the first patient was admitted on the 24th, and as of the 18th of April, there have been a total of 13. That's only 13 patients admitted. 4 of those had COVID detected on a swab test, and 9 not detected. But at the time, of course, the admission was based on the clinical criteria and the clinical suspicion at that point. None of those patients have needed a ventilator. 1 needed some high-pressure oxygen through a mask. As the Minister says, we're doing extremely, extremely well now in terms of our discharges. A quick reminder from the GHA about our visitor policy. I know this is something on a lot of people's minds for patients who are in hospital, whether they've been admitted for a potential or possible diagnosis of COVID or for anything, in fact. Our visitor policy, of course, is quite strict now. And we do thank everybody for their understanding and sticking to what I suspect will be very difficult, not only for those people who are actually in hospital, but for those who want to come and visit and support their loved ones. The key message really here is that visitors will only be considered in exceptional circumstances. 1 visitor, and that's not 1 visitor who can swap with another, and then the cumulative total is maybe 5 or 6 visitors. This is 1 nominated visitor, an immediate family member or carer, and that's the only person that will be permitted to visit. And that will be at the discretion of the ward manager based on how many patients are in the ward at the time and the workload and the demand on the ward. We will, of course, have certain strict criteria and requests. If somebody comes to visit on the ward, you must clean, you absolutely must wash your hands, and every time you leave the bed and return to the bed, we would expect you to wash your hands. We would ask every visitor to sign in so we can keep a record, and any external garments such as coats, we would ask you to leave those in a designated area at the entrance to the ward, to just minimise the transition of any infections, not just COVID, but any infections into the ward. There are, of course, some exceptions to this rule, and all of these pieces of information are available on the government website, and they're available on the GHA's website and the public health websites as well. But elderly residential services, we're not at this moment allowing visitors in. Of course, I'm sure everybody can understand the reason why that is, because our residents in these facilities are at the highest of risk. The same will apply to the COVID ward, which is the COVID John ward, and the CCU, which of course are our wards where we would potentially have patients who may have the COVID infection, and therefore that represents a risk to anybody who's visiting. In terms of Victoria ward and Dudley Toomey ward and CCU2, which is the non-COVID intensive care, we would allow 1 visitor. Accident emergency, no visitors are allowed again because of our increased risk. And the field hospital, albeit that it's empty at the moment, if the field hospital has patients in, no visitors will be allowed there either. Now, moving on a little bit, I'm going to try and go through a few questions that people are wondering about at home and questions that they've asked me over the last few days. And one of those is about medical treatments not related to COVID. So, of course, we have absolutely not forgotten that medical issues need to be managed. Follow-ups, treatments are, of course, ongoing. And simply because we are focused so solely on the COVID doesn't mean that we've forgotten that there are many people that are expecting referrals, consultations with a consultant, and we have absolutely not forgotten all of the things which may be going on, and some of which, of course, are very significant, such as chronic diseases that may not be controlled, suspicious cancers, all of those kind of things. So urgent and emergency treatments, of course, are ongoing, such as the 2-week wait for cancer referrals are still being managed. You may have noticed, in fact, I'm sure you have noticed that some of the format of how we would look after you has changed, and you may very well receive a phone call first, particularly from primary care, for example, and some of the consultants are making telephone calls as well to look after you and keep you at home and keep you away from the hospital where possible. But my medical teams are now looking very closely at what we can do at a time when perhaps we could argue that we have all this spare capacity. We give you the figures for the bed statistics. We have these teams ready on standby, all of this expertise, but we are not seeing the patients that we were anticipated at this moment from COVID. So all of this medical expertise is now concentrating on how we perhaps increase the number of patients that we see and look after and start working through some of those waiting lists. But the one thing I would have to say is that we are looking at this very, very closely based on very strict criteria. For example, how long perhaps you've been waiting, what medical issue it is that you're waiting to be seen for, what the procedure may be that you are expecting, the risk of waiting versus the risk of being exposed to COVID. We must always remember that we have patients who potentially may have COVID infection. And the one thing I can absolutely assure you is we will not put you at risk. And so that means that sometimes we may have to balance this risk and say that this is a medical condition that may have to wait, but we are absolutely looking at this. The other risk, of course, is that potentially if you have a procedure or a surgery, maybe that will lower your defences and that might leave you at increased risk of COVID. As I say, the one thing we will not do is knowingly place you at risk. But nothing is firm as yet. My teams are looking at this, and we will take this all into consideration, bearing in mind the necessity for only going out if you absolutely have to, bearing in mind the way that we are working at the moment with our telephone consultations and more distant consultations. But we would also like to take into account when we do this some of the measures that we've put in place so far, which have been a huge success. Telephone consultations, video consultations have been an amazing success, and I will reiterate thank you very much to everybody at home who's actually supported us in that and allowed us to put these things in place. The 111 line, of course, which has been an enormous success, and our public health specialist from the UK actually said that these were gold standard measures that we put in place. And so these are things that we would perhaps like to continue. And as such, when we start looking at restarting some clinical activity, these are the things and some of the methods that we would deliver this. But of course, we're also going to focus now a little bit more on going forward. At some point, we will start to increase our normal routine clinical activity. When we do, we would like now to focus a little bit more on lifestyle, on exercise, on preventative care. And I suspect all of us at home have now realised that the focus now in our defences is very much on our immune systems, on our health, and keeping us fitter so that we can fight infections like this and that we can live better, stronger, longer lives. So we will focus on lifestyle, we will focus on exercise, we will focus on perhaps some of those conditions, those chronic conditions which are preventable, and that we can help, maybe even help you get off medication if necessary. Moving on a little bit to the care assistants, you've seen the requests for volunteers for the care assistants. We have had an overwhelming response to our call for care assistants. Over 300 people, in fact, have contacted us, and for this we are truly grateful. However, we're not accepting any further applications. We've trained 70 people so far, and this is enough for our staffing at the moment, and everybody else has contacted us. We'll keep your details, and we will contact you if we need it. But thank you very much indeed for contacting us and for volunteering to help. Some other questions that have come through that I've been watching on social media, the in-house testing. People have been asking a lot about the in-house testing. We are now running 2 testing systems. The laboratory have been amazing in getting some very, very complicated systems together. One is slightly quicker than the other, but the one thing to say is there's a lot of focus on these rapid tests. But my advice really is that the test itself has to be reliable. When we give you a result from a swab, if you've been somebody who's been swabbed, we all want to know that that swab result is absolutely reliable. So we're looking at our 2 mainline tests at the moment, and we are exploring faster tests, but as long as the result is reliable. I've looked through some of the evidence as well, just to give you some more information and background. And one that's been very interesting in the research that's come out recently is that what's quite a strong predictor for a COVID infection is a loss of taste and smell. And in 59% of cases, looking at these symptoms, and I think I share everybody's frustration at home that the list of symptoms for the COVID infection seems to get longer and longer as time goes on. And I think this has come into more focus at the moment because one of those symptoms was sneezing. And now we're in the hay fever season, so lots of people are sneezing. But it's interesting that loss of taste and smell with no nasal congestion. And for those of you who suffer with hay fever, who are completely congested up, you will definitely recognize the difference. The consistent symptoms, of course, seem to be cough, fever, and shortness of breath, as this is a virus that will affect your breathing. We had a question the other day which was answered by the Director of Public Health about this antiviral remdesivir. This was originally an antiviral used for the Ebola virus. But the trial that was carried out was only on a very, very small number of patients, and it's not been a reliable trial so far. I can, of course, assure you all that we are looking at all of these different trials, and if something starts to emerge which is a strong evidence, we will, of course, look at it, and we will consider any medication. But I will reiterate, of course, as I've said a number of times, please don't experiment with medication. Please don't believe some of these studies. They may be false studies, or they may not be big enough studies to give us consistent advice. So please don't try and buy these things over the internet. If we have strong evidence, then we will consider it. But we will absolutely, I can promise you this, we will not experiment on anybody in Gibraltar. In fact, we will not experiment, and I know health services will not experiment on somebody with a treatment which has not been proven so far. Some other questions that I thought people maybe are wondering about at home. People are asking about this antibody test, and I'm as desperate as everybody else to understand about the antibody test and about the immunity. And many people have asked me this question: if we knew about an antibody and we had an antibody test and we knew everybody was immune, or half of us were immune, and we'd all had it at Christmas when everybody was sick, perhaps we could relax a little bit, and some of us would be immune and not have to worry so much about it. But in actual fact, this is something that has been very elusive, and you may have read in the media recently that the UK spent £16 million on antibody tests which turned out to be unreliable, to say the least. Spain also spent untold millions on the same thing. So the problem here is that the immunity seems to be relatively short-lived. Coronavirus, as I'm sure you recall, is not just the coronavirus we're dealing with now, the COVID-19, but coronavirus is a cold virus. There are lots of different types of coronavirus, and every year we get viruses which cause the common cold. So the immunity is short-lived, it's a little bit elusive, and there may be other immune problems going on, or immune reactions going on, should I say, which we don't understand fully. If there is a reliable antibody test, we will absolutely let you know, and we are looking at this every single day, as are every other country as well. However, it's interesting, isn't it, that from the swabbing perspective, we've actually done very well. And there are some countries which are listed in terms of number of swabs they've done per head of population. And if you look at the statistics that Minister has given you, it works out to be about 1 in 16 of the population that we've swabbed, which is, I would say, is pretty amazing compared to a number of other countries. And we are ordering swabs, we're stocking up on swabs all the time, so we are making sure that we won't run out. Minister has also mentioned about this weekend and how difficult it's been this weekend, because it's been a beautiful weekend. Last weekend, Easter weekend, was perhaps a little bit easier, although it was a family weekend. because the weather wasn't so good. But this has been a very beautiful weekend and very difficult to stay indoors and look at the sun outside. I'm just going to reiterate a little bit about the fact that we do understand this. We do understand the mental strain that everybody's under at the moment and how difficult it must be to stay in. Minister has given you a little list of those things that we can do to try and fill our time and tackle some of those things which perhaps we've been putting off when we've got some extra time. I know there are many of you sitting at home at the moment, perhaps even shouting at the screen, saying, I've done that, I've tried that, I've had enough. I can't keep this going anymore. And I'm asking you, please, to keep your resolve with this one. But if you are feeling like you need to talk to somebody, if you're feeling that your stress levels are high, please don't forget that we have a number of different people that you can speak to. Don't forget Jib Sams, who are on 116123. Clubhouse, of course, we mentioned Clubhouse. They're on 200 68423. Again, these numbers are on all of our websites. Childline, of course, 8008. These are our well-known numbers. And, of course, we have trained counsellors who've been put into place to help support you. And if you call 200 41818, we will advise you and we will put you through to our trained counsellors. And so my last thoughts really for today. I'm going to start this with a little story and a little apology. About 10 days ago, I went to Morrison's at about 7:30 in the morning. And I just breezed in front of this whole queue at 7:30 in the morning. In fact, it turned out to be a queue of all of my colleagues working who are also in the emergency services, also queuing up at Morrison's at 7:30 in the morning. So the first thing is an apology, and because I absolutely didn't mean to jump the queue, but it was 7:30 in the morning, and I suspect half of my brain was still in bed. But I actually reflected on this a little bit, and it strikes me really that in all of this, there was not one cross word. Everybody was smiles. Everybody was understanding. Everybody was in the same place because we are all out of our routines. We're all out of our comfort zones. We're missing our support networks. We're missing our friends. We're missing our families desperately. And yet, the one thing I've seen so far is so many smiles, so much tolerance and understanding, so many hellos and greetings. If you are out exercising, people are waving, they're smiling, they're saying hello, keeping social distance. But it's amazing how united this community has become. But I do understand that thoughts are turning to lockdown more and more. Our Minister has certainly covered this. But we've done so well. We've done so well so far. We've had only 13 in our intensive care. We've had not a single death. And the statistics every day, myself, my colleagues and my ministerial colleagues are all very, very proud to give these statistics because they show that the rate of the virus spread is reducing at this point. But to simply unlock now, to release all of that hard work that we've done, it would be almost like doing all of the revision and not doing the exam. It would be so much hard work potentially wasted, and I'm sure many students out there are feeling this very thing. But all of this hard work, and in actual fact, the balance is very, very fine. The decision will not be an easy decision, and absolutely, John, I agree with you entirely that I think this decision will be a much harder decision than the decision to introduce the restrictions in the first place. But I would please ask you just to remember that the incredible statistics that we give you every day, beds, free beds, medical equipment, medical teams and preparation, all of their hard work, yes, it's down to them and their hard work, but actually, if you think about it, it's down to all of you at home as well. Every single one of you, keeping home and keeping safe, observing the restrictions, slowing the spread of this virus, have given me, have given my colleagues, have given us all time to prepare, to stock up, time to practice again, time to assure you that we are ready. So this is truly a team effort, and we're asking you now to stay in that team, keep part of this effort going. We have done this. You have done this so far. The statistics we're giving you today, you should be beyond proud of yourselves. So I'm asking you please to keep it up, keep strong, don't lose your focus or your resolve, because there is no doubt in my mind we will beat this. We must beat it, we have to beat it, and we will, but we will beat it. And we will open the doors and we will mix together, we will laugh and we will joke and we will put this behind us together. But for the moment, I'm asking you please to stay at home, stay safe, help us to fight this at this moment. Thank you very much.
Krish, thank you very, very much for those words, which I'm sure everyone appreciates. There are three other people in this room. I have to thank the GBC representative with his camera and the 2 members of the team of the press office who are here every day, bank holiday, Sunday, Saturday. So thank you for all the hard work you're doing in helping us put this to the community, because the community needs to be aware. So having been so nice about the press and the media, I'm now opening myself and Krish to their questions.
Thank you. Good afternoon. The first question is from the Olive Press for Minister Cortés. Have you received the final results for the 18 GHA workers which were tested as part of the outbreak at the Children's Health Centre? Do you have any further information about it in regards to who caused it and how such a large amount of people became infected? Was the index case the person who was briefly interned at the COVID ward? And do you think better prevention measures could be carried out at all medical institutions in the future?
Okay, I think most of this question will, in fact, be answered by Krish, but I just have to just say that the impression given by the question is that somehow something awful happened, and it's not like that at all. Remember, this virus is out there, it's in our community, we know it is, it's very easy to be passed on from one to another. It may not, people are assuming that something terrible happened at the health centre. It could have happened out in the street, it could have happened shopping, collecting a takeaway, so let's not be too harsh on the hard people with all the work that they're doing and how careful they're being in order to protect themselves, their patients and our health service. But I think the detail better comes from you, Krish.
John, thank you. Yes, so there's obviously lots of elements to that, but what I can say to you is that everybody from the Children's Health Centre who were part of this cluster, this wasn't perhaps an outbreak as in lots of people had tested positive on one day. The cluster, which happened over a space of about 3.5 weeks, all of those people are well. The index case was not the person who was admitted, and this really demonstrates very clearly that most people that have this infection are asymptomatic. So they come to work with no symptoms whatsoever, or they walk down the street with no symptoms whatsoever. So I know I'm going slightly off topic, but you know, a lot of the recommendations we have for the social distancing, for staying at home, are because potentially somebody who you may walk into or walk past on your walk down to Roja may have this infection, and this is why we're asking you this difficult thing about staying home. But I can assure you that, number one, the staff are well. I think really the best thing to say about this is that this really demonstrates how well prepared we are. And how we've reacted to this one. So as soon as we were aware that there was a cluster, and if you think back to last week when we were aware there was a cluster, we sent home a significant cadre of staff. We swabbed them all, and virtually all of them, apart from the few that we'd already reported tested negative. We deep cleaned the whole of the Children's Centre in perhaps less than 6 hours after we'd even announced this cluster, and the next morning the Children's Centre was back up and running. And seeing patients, and completely safe to see patients once again. So I think, as John says, the terrible thing didn't happen. Don't forget that places like the health centres, the Children's Centre, places like Morrison's, for example, these are places now where people will come. Most places now are shut. So Main Street, of course, is shut. The shops are shut. So of course, those places where people are going to congregate potentially may cause you an outbreak or a cluster or just a few cases. But what I can, of course, say to you is that our procedures were tested. They were tested well, and I think we did a very good job. And I was very impressed with our team who managed to clean it and back up to work the next day. So, of course, the final thing to say is that just demonstrates that no matter what happens, whether we have a cluster, an outbreak, or a lot of members of staff who are taken ill, we will not reduce the preparedness of our medical services, and we will continue to provide you medical care.
The next question is also from the Olive Press for Dr. Rawal. Could you clear up the situation regarding exercise allowances on the Rock from a purely medical perspective? The RGP Commissioner in his statement said that exercise periods should be short, but how could this impact the spread of the virus if social distancing is applied at all times? In relation to this, our growing surfing community has complained that surfing has been banned on the Rock by the RGP. Could you clarify that this is not in any way COVID-19 risk, along with swimming, as they are forms of exercise held in antiviral salt water as opposed to recreation?
Okay, so this is lots of questions about the exercise, and of course we are asking you to stay at home and stay safe, but of course we are also asking you to keep well and allowing people to go out for some exercise. And I don't think the answer to this question lies simply with surfing, although I do understand the question and why we would ask about salt water and swimming in salt water. Salt water, of course, has very beneficial effects for the skin and for the health generally. However, there's more to it than this, and this is all about everybody being able to do a little bit of those under 70 being able to do a little bit of exercise. Now, surfing itself, the problem is not the surfing. Surfing itself is not banned. What we're saying is that prolonged periods outside are not advised. They're against the restrictions. And the reason for that is that we go out, we do our exercise, and we go home. There are 36,000 people on this rock, all of whom all of those under 70 want to do some exercise. And so if some of us go out for 2 or 3 hours, then that is going to actually cause a problem for those other people who want to come out, do some exercise and maintain social distancing. The surf site itself, if you want to be specific about surfing on Eastern Beach, as a surfer myself, albeit a very bad one, I know that the break is very small there. So what that's going to do is that's going to encourage lots of people to come together. And I personally know that going surfing at this time of year is going to take more than 15, 20 minutes or half an hour, because by the time you've put your wetsuit on and you've gone out into the water and gone surfing, it's going to be the half an hour's up. But we must give everybody the opportunity to do some exercise. So really the idea here is to go and do some exercise, keep well, keep mentally and keep physically well, but just really just focus on doing some short exercise, get out there. The best thing by far and away is do some walking, do something that can maintain your social distance. But please, I would just ask you just to be aware that everybody else would like to do the same. So if we're maintaining social distancing, let's give everybody a chance. Let's go out for a short period of time and go straight home, keep safe, and allow everybody else the opportunity to do the same.
A question from YGTV for Minister Cortés. The RGP has today closed off access for vehicles heading to the beaches and the Upper Rock Nature Reserve. How sustainable is the current lockdown now that the weather is improving?
Okay, I think there's two parts to this question. The RGP, which, as we all know, together with HM Customs and the GDP and all the law enforcement agencies are doing an excellent job in a flexible and proactive manner. What's happened today is it's the first really nice day for quite a few weeks. A lot of people are up and about. There was tremendous volume of people, including cars, going to these areas for exercise or for whatever. And therefore there has had to be some control today because of the exceptional circumstances. There simply isn't enough parking spaces on the Upper Rock for everybody to suddenly drive up. So the police, in a flexible and proactive and a very positive way, has been controlling the numbers of people so that everybody, as Krisha said, is able to do a little bit of exercise, but not go and sunbathe and picnic and so on and so forth. So this has happened today because of the circumstances. The police is being flexible and responding to the situation. And we repeat that it's about going out for short periods, for good exercise, but it's not an excuse for social gathering, and we have to be sensible about it.
So, John, if I may, just to go slightly back to the question about surfing, I think we have to absolutely applaud the RGP and everybody else who's helping us with this. So if the police say to us that a particular activity is banned, it's not because they're being heavy-handed. It's because what they're trying to do is protect us. And if they've identified a particular gathering of people or potential for a gathering of people, and they've just asked that we try and keep away from that one, I don't think that is necessarily an unreasonable request. And I think at this moment in time, in these extraordinary circumstances, I think we should just not necessarily question what they're saying, even if perhaps we're wondering about the validity of it. But let's just allow them to protect us.
In fact, we should thank them.
Yeah, I agree. Yeah.
A question from GBC for Minister Cortés. You've highlighted the importance of respiratory health if COVID-19 becomes endemic. What is the scientific advice regarding the likelihood of COVID-19 becoming endemic and social distancing measures becoming a regular feature of our lives? And can you give an indication of the government's planning for this?
This is interesting. This is the first part is more aimed at my scientific background than my political background, but I'm sure that Krish, as a medical expert, will want to add to this. I do have something in my closing words which is relevant to this. It is quite possible that this novel coronavirus, will become endemic, that it will become established in our repertoire of human diseases, like the cold and the flu. It is possible that it will mutate, not necessarily in a bad way. It may mutate to become less lethal. It's in the interest of every parasite, including a virus, not to kill its hosts, because if its host dies, it dies too. So it might mutate and be less, we don't know. But I think that we have to bear in mind that if it does retain a certain amount of the current lethality and it becomes endemic, we have to be much more careful in our social distancing, in our washing of hands, and how will the government respond? The government responding whatever way it has to, following the advice and tracking what the virus is doing. I think for the foreseeable future, we have to go easy and learn these lessons. Krish, do you want to?
I think I mentioned it very briefly when I was talking earlier. You know, we're desperately seeking an antibody test, and of course, you know, many people are talking about vaccine. But these things, there is no vaccine for the common cold, and coronavirus is a cold. It's from the cold virus family. So the immune response in the body is not certain. I think the general feeling, albeit that the research is being looked at and is emerging, is that this will become just part of life. But isn't it interesting is no matter how complicated the research, no matter how many hundreds and hundreds of thousands of people have been affected, there are some very, very simple messages here that seem to be consistent and that seem to have helped, such as washing your hands, the social distancing. Now, whether we can social distance for the rest of our days, I suspect may be impossible. But of course, there are things we can do. We can think about this. We can reflect on this. We can be better with our hygiene. I'm sure we can, and with our washing our hands. And perhaps we can actually focus a little bit more. You know, we're very technologically. We're being a bit philosophical here, but we're quite a technologically focused in this age. And maybe it's possible that we have drifted a little bit away from just looking after ourselves a little bit. And maybe we need to bring this focus back to good health, good lifestyle, better levels of exercise, just conquering those medical conditions, which I think many of these medical conditions are preventable. Blood pressure sometimes is a preventable thing. There's definitely diabetes, type 2 diabetes, which is preventable. All of these things I think we can deal with good health and with good lifestyle. And this in itself, if we want to go back to where we were before in terms of our social close social contact, I think we have to be prepared to do what it takes to make ourselves stronger and better to be able to do that.
I think we're allowed to be philosophical on a Sunday afternoon.
Yes, absolutely. Thank you, John. Yeah.
The next question is from the Chronicle. In the OT study mentioned by Dr. Cortés, Public Health England estimated around 300 deaths in Gibraltar had we taken no measures. How does that figure compare to the estimates prepared by the GHA early on in the crisis? Do the numbers tally? Additionally, does Public Health England's analysis offer any insight as to how we might adjust our response, given the small number of cases here?
Okay, the numbers are comparable. I can't recall because obviously there are different models which have come up with different figures, and I've read so much about this over the last few weeks that I wouldn't want to pin myself down. But certainly, had we taken no measures and had the disease gone in the way that it has, for example, China, Italy, Spain, and now we're seeing in the UK, there would very possibly have been several hundred deaths. But as I said earlier, a model is a model. It hasn't happened here. It hasn't happened here so far, may I hasten to add. And I think that is obviously a sign, as we both said, that the community is together in this. The second part of the question was to do how we might adjust our response, I believe, in view of the small numbers here. Well, the small numbers here are one of the boxes we need to tick when we consider how we unlock and what steps we take. But it's not the only box. There are other boxes. The proximity of a source of infection, like there is, for example, across the border, is one of the considerations that we have to bear in mind, and other things that might develop. So it does give us an indication that we have contained it in Gibraltar. I don't think anybody can doubt that, but it's only one of many different considerations we have to have.
The next question is from YGTV for Dr. Rawal. Every day we hear that the number of people with COVID symptoms are attending A&E. Is the GHA still trying to discourage this? Are most of these attendances via an ambulance, or are people ignoring advice and turning up at the hospital, potentially putting others at risk?
In actual fact, when I first started to work for the GHA, I actually worked in A&E. And at the time, on average, there were about 100 to 110 patients attending every single day to A&E. And now it's around about 30. So in itself, people absolutely have heeded the advice that we've given them. A lot of people are using the 111 line because this seems to be a very reliable and much welcomed source of advice. So I think the first thing to say is that if you put that into context, that's less than a third of the number of people attending A&E that used to be. But of course, some people have to attend. We can't just expect every single medical condition to be dealt with over the telephone. In fact, quite the opposite. We need to allow our clinicians to speak to people face to face where necessary, to examine people and to give people treatment. So I don't think people have ignored any of the advice. I think people are coming because they have to. I definitely know from my discussions with people that people are definitely thinking about it before they come, using the 111 line a lot more, using our fantastic GPs a lot more, and seeking advice before they come. So I think we have almost established a baseline level of where A&E should be in terms of the number of patients that are coming. And I have no doubt that if we can keep some of our new measures in place, that hopefully that's where it will stay.
A question from the Chronicle for Dr. Rawal. You mentioned bringing in additional expertise to help manage Gibraltar's response. Who are these experts and what will they do?
Okay, so in fact, we've actually brought in a lot of expertise so far. And as you recall, in a number of our press conferences, we've talked about Public Health England, who've sent some of their advisors to us already. We've had some excellent support and advice from the military as well. We've had some doctors who've come in from Health Education England as well. So what they've done is these are people who have experience with this already. And these are people that work within the public health environment as well, and they've come and they've helped us assess what we've put in place and whether there's anything that we need to improve on, whether there are any gaps in that, because we can be as prepared as we can, as prepared as we feel we are, but there's absolutely always an opportunity to reflect on that to make sure that we can do better. And so these experts, or these advisors is probably a better way to put it, have come to help us and support us. And actually, some of our teams are working extremely hard with very small numbers because this is unusual for us to deal with such a global pandemic. And so, for example, Public Health Department ordinarily is a very small department, but we've needed to bring help to a number of departments so we can do our best. And we can support the people who ordinarily work for the GHA so that we keep their expertise, they don't get burnt out and exhausted as well.
And the final question is from GBC for Dr. Rawal. We have heard from the GHA's consultant microbiologist that the faster tests are reliable, especially when done from RNA, and that those done directly from the swabs only have a slight loss of sensitivity and can be quickly retested for false negative if needed. We've also heard from Dr. Bhatti that these tests form part of the 4 assays currently being trained for. Can you confirm that they are, and where the GHA is in terms of training for carrying these all out?
Okay, so I can absolutely confirm to you that we do have 4 testing platforms in total. And as I said earlier, when we were discussing this earlier, it's all about reliability of the test. The swabs themselves can be unreliable just in themselves if you don't swab in quite the right place. Sometimes there is the potential to get a negative swab when maybe it's positive because you've maybe missed that point where the virus is. So we must use any tests that are absolutely reliable. But bear in mind that that if we have a what I would call the kind of the mainstay test, what we call our open PCR test, which is running samples in a minimum time of about 6 hours. Then we have these new tests which are coming online, which actually do process things in shorter and shorter time periods. But each of these machines needs proper validation. And what perhaps this is slightly ironic in terms of some of these machines, to validate a machine properly, you need to put in a swab which you know is positive and a swab that you know is negative to check that the machine, the system, gives you the same reading. And of course, as you've seen from the statistics, we've not had a positive for a while. So of course, we can't validate some of these machines. Interestingly enough, we've almost been too successful in our measures to validate some of these machines. So I mean, clearly, our consultant microbiologist knows these machines absolutely much more in depth than I do. But I do know that we've got 2 other platforms which can process much faster. We also need to bear in mind that every single time that we do this extraction of this RNA, the genetic material from the virus, we need a reagent to do that. And those reagents are in global demand. It doesn't matter whether we've got 2 tests, 4 systems, or 20 systems. Global demand for swabs and global demand for reagents. So while we are running some of these tests, we are keeping our avenues open in Spain, so we can send some tests to laboratories in Spain as well. We are making sure that not only are we able to provide quicker results, which I'm sure you've noticed over the last few days, the laboratory have been fantastic to provide quicker results. But we must not allow ourselves to run out of anything, or potentially, just in case we do have a surge. So this is quite a fine balance. But as these things come online and as we get more and more reliable, we will, of course, be providing the test results faster. But as long as the result is the reliable result, that's what counts.
Okay, thank you. No more questions.
Thank you very much. Thanks, Krish.
Thanks, John.
So one thing is clear. And in fact, this is something that we discussed with Professor Heyman of the World Health Organization a few days ago, and with which he agreed. If COVID-19 becomes endemic and becomes a regular feature of the disease repertoire of our species, like the flu and the cold, and unless it mutates into a less virulent strain, we will need to learn to live with it. This means that living into our 70s, 80s and 90s may be more difficult than it has been in recent decades. We have to ensure that our over 70s are as fit and healthy as possible in order to be able to overcome COVID-19. As someone who is in his early 60s, this is sobering and worrying. It's a call to do something about fitness, weight, and for those who smoke, about smoking, health in general. We've always known it, now it's suddenly become urgent. For now, let's please follow the advice. Do what our experts and experts the world over tell us. But make the most of your time. Concentrate on the positives. There is light at the end of the tunnel, and there is an end to this tunnel. We must be patient. And many of us in Gibraltar are showing that patience. The patience that got us through the years evacuated and the years of a closed border. So, to protect the GHA, protect the most vulnerable, to save lives, to help us to be able to get back to some normality sooner rather than later, stay home. Keep your distance. Keep safe. Together, we will overcome this, but not too close together, eh? Have a good afternoon and see you soon.